is a new large study now out looking at any link between Tylenol taken during pregnancy and autism or ADHD. It comes after the Trump administration's announcement last year linking the use of acetaminophen, which is the active ingredient in Tylenol and many cold and flu medications, and that use during pregnancy to an increased risk of autism in children. CBS News medical contributor and editor-at-large for KFF Health News, Dr. Celine Gounder, joins us now to talk about the study's findings. Doctor, thanks for being with us.
Great to be here, Marie.
I know this is a hot topic. There's been so much discussion surrounding Tylenol during pregnancy and autism. This new study in Lancet says there is no link. What should people take from that?
Marie, this is the most comprehensive and methodologically rigorous review we have so far. Researchers analyzed some 43 studies from around the world, and when they focused on the strongest designs, so the best quality, highest quality studies, especially sibling comparison studies, they found no evidence that taking acetaminophen or Tylenol during pregnancy increases the risk of autism, ADHD, or intellectual disability in the baby.
And there's something to be said specifically for this sibling comparison study, yes, that sort of elevates the information we have?
Yeah, because it really gets at the biggest source of confusion in earlier studies. Genetics are by far the biggest risk factor for autism, and by comparing siblings where in one pregnancy mom took Tylenol and in the other she did not, you're automatically controlling for shared genetics as well as other factors like the home environment and socioeconomics. And so when the researchers did that here, they saw the associations seen in earlier studies disappear, which means that in fact those associations were actually related to genetics or some of those other risk factors.
Makes a lot of sense to look at the data that way. So lastly, doctor, if a woman is pregnant, she's watching this right now, hearing about this new study and these findings, what should she know? What would you tell her to do? Should she consider taking acetaminophen at any point?
Right, so this study reinforces existing guidance from groups like the American College of Obstetricians and Gynecologists. Acetaminophen remains the first-line option for pain or fever during pregnancy, taken as directed, of course. Medications like ibuprofen and aspirin are not safe to be taken during pregnancy and can cause fetal abnormalities. So acetaminophen is really the go-to during pregnancy. And this study is really about reassurance. The best available evidence says Tylenol is not causing autism or ADHD. If you're pregnant, you should feel safe taking Tylenol during pregnancy. And if you took Tylenol during pregnancy in the past, you should not feel bad about it. You didn't do anything wrong.
CBS News medical contributor and editor-at-large for KFF Health News, Dr. Celine Gounder, thank you so much.